Just want to talk this one. Is that fine? Just say initiative on because most of the people you are working on Tracker or the name-based system. Yeah. So we will try to finish on this. Fine, fine. Group number 2. Group 2. Okay. Just we have 15 minutes for the lunch break. I'll just quickly go through this one. It's about the brief history. I don't go about that here. In public health surveillance, we always gather the data, analyze it, and have the feedback to the stakeholders and to enable the improvement. This is the whole concept about why we are working. To collect the data, analyze them, share, give the feedback, and move towards. So is this okay? Now, reproductive health registry, like in Norway and other countries, we have different registries, where we collect the data. But the problem, what we usually face with the wrong denominator. Denominator for, say, maternal deaths, stillbirths, we are not able to collect. In most of the countries, even for live birth, we don't really get the whole picture. We have very good ANC coverage, because that's what the health department is focusing on. But very bad live birth. So if we just start with the live birth and then getting some of these details, it will be a bit hard. So the focus of the HR is to start with registering the pregnant women and track across the immunization cycle, and then just not for the whole immunization cycle, but just on the birth. Yeah, birth and the PNC details. Okay. So harmonized reproductive health registry. It's an initiative from Norwegian Institute of Public Health, Norway, in collaboration with WHO and from various other institutes. This is to make sure that we harmonize all the efforts, try to get the data, right data, and to start the process. There are 1, 2, 3, 4, 5 components, and plus 6 actually, which is not mentioned here. Whenever we start about the reproductive health registry or any kind of registry, the first thing is ethical and legal and social implication on collecting the name-based data. Here, I guess one of the countries where we had the privacy laws. I guess, was it Malaysia? Data privacy laws? Or was it Philippines? Philippines, right? What about in Malaysia? Do we also have data privacy laws issue about because it's a granular data? Who should be able to access this data? How can you share this data with the universities? Can we share the names of the persons to the university research? So at what level the people should have the access of the data? And what are the different policies what we have? And there is one professor from Oxford University. She's been leading this group on saying what are the ethical and legal issues of registry, how it should behave. Because there are different standards, even let's say, Norwegian ID. A Norwegian ID is considered to be as not so good because it gives Norwegian national ID, it's used for everything. Even for tax, banking, everything, they use Norwegian ID. But Norwegian ID is your date of birth, and the next is if you're male, if you're female, 1 and 2. And then some random numbers. There is also lots of talk on this one because this is giving your personal information to everyone. It's giving your gender information, it's also giving your date of birth. So that's why they say, most of the community, they just say, unique ID should be no meaning attached to it. It should be a random number. And then it has to be with specific purpose. In some places say, okay, TB number should be only for the TB, HIV/AIDS is only for the HIV/AIDS, and then you have other things. There are different discussions going on this one. So, but these are the different things. When we start with, example, in developing countries, we don't really have a national ID or one ID. Even in India, right now, we started with this UID. Before that, even it's still in the UID, it's still under process, giving each person identification. But we don't really have like identification. We have passport, yes, we have PAN card, but like not everyone has the same. So you have various different voter ID card, all the different types of unique identifications is there, and this is another big topic. And some of the places we don't even have the person to have any identification. So how do we track it? And like when we collect the names of the individuals, from which level we can move it up, and where it has to be stored, and how are the different encryption should happen. So these are the different things the ethical and legal issues work group is taking care. Yeah, and this work package, it deals also with the sharing of the data, because health data, like when we are trying to collect especially granular data, it also allows lots of research activities. So you can say like, okay, the university should get an access of the data so that they can view. But then like, does all the names and everything should be hidden? What kind of location should be showed? Whether it is only the district name should be appeared, or whether it has to be a sub-district name, or the village name can appear. So which level of the name should appear when you share the data across university? Yeah, across different departments, even in the health. So if you want to share the data, how you should share. One of the concrete use cases is EPI, or mother and child care, and HIV/AIDS. So they both maintain separate data, separate files and separate things. They don't really want to talk to each other. One of the main reason, because HIV people say, no, this is very confidential and privacy. So we want to keep everything together. So we don't want to share this one to anyone else. And HMIs, or the mother and child care, they say, okay, data is here. Anyone can come and look at it. But it's also, how do we make sure that like this can be used? The second one, it's on indicator and essential indicators. Okay, this is the name of the people who is dealing with different work package. Jane is from the University of Oxford. She's working on the ethical and legal issues. This is from Australia, Vicky. I've been looking at the work package 4, which is basically on E and ML solutions. And Jagrati from Norwegian Institute of Public Health, she's looking on training and coordination aspects. And these are the other contacts from WHO and NIPH. Yeah. So sensitive data, data analysis. So what are the legal mandate for establishing a registry in the country? Do we really have a legal mandate? Because there was one professor from Singapore, he was saying that Singapore has done quite a lot of work on this one. And like even here, like even from AHIN, we can like try to see what are the different aspects to start with this registry. Registry is very different from collecting individual records. Registry is just like, okay, these are the different person and these are the different things what we want to try to collect, focused on that particular place. So harmonizing reproductive health registry is focusing only on reproductive health registry. It's not about like creating the whole national patient database. No. That's not the point. Yeah? Okay? And here, like, there are lots of interventions. For example, in different countries, we collect different data, different types of data. But what are different essential data what we need to collect for reproductive health registry? Yeah, in some places, we collect ANC1 to ANC4. In some places, ANC3. Some places, we have ANC7. And some places, we just collect this one. We don't really collect some other more details, like every ANC should be tested for HIV. Do we have that in law? ANC for HIV? Yeah, but like in the national, in the HMIs? Yeah, so like these are the different things what we need to try to include. Whether can we include it in the national core team, because ANC for HIV, it's also one of the minimum development goal, right? As I remember, Arthur was talking about it. Yeah, so you can use these different sets of data. Like, for example, you have untitled care, childbirth. These are different numbers of indicators are linked to different groups. For example, intervention, screening, treatment. And then, like, when you start with the process, like usually a health worker which says, okay, like these are the different things what you need to collect, essential ones. If the country is more advanced, then you can expand it. So you can use chunks of start from essential, minimum, essential, and then like you can try to get more and more as you go forward. Yeah, these are just different work group ups. Yeah, action focused and things. I don't want to get into too much in that. Like here, like, do we know about this one? Classification of ICD-MM and ICD-PM, the WHO classification. Like we already know about ICD-10, right? So this is also like it's ICD-MM and things. Clive can explain a bit more. Sorry? Not the public health guy. I said like Sri Lankan, they are all our doctors and. Yeah, okay. And then it comes for mHealth and solutions for registry. So the focus here, and this is what you're going to help me with. Like every country wants to start with their collecting the name-based data in an electronic format. Whether it is in India, whether it is here, whether it is in other places, we always want to collect name-based data either by tracker or by any other means. So first thing is, what are the different functional requirements for a reproductive health registry to collect name-based data? What are the different security issues that open source or a E and ML solution should have? Yeah, one of the things which we are restricting ourselves is we are just talking about free and open source, because we can identify all the open source systems which are in this particular area. And then the whole aim is if a country just starting up, then we can say, here are the different tools. If you want to start, these are the ethical legal tools, these are the tools for data collection, and this is the tool for your E and ML solution. This is free and open source, and these are the different support mechanism, training things which you can use for your country to start your reproductive health registry. Yeah, so this is not only about DHS, it's about like the functional requirement. And given in this group, we already have technical person, we have a public health person, and Sri Lankan doctors. Yeah, and then because we can identify what are the different things what we want to the IT solution should provide us in our country. Yeah. That's what like is a functional requirement. What are the different things what the IT solution should do? That's the one of the things. And then we put all those things down, both E and the mHealth. And then we try to see, okay, based on this functional requirement, we'll try to assess what are identify different open source solution, which can record name base and things. And we look whether this criteria has been solved or not. Yeah, whether like if you want to use a software for reproductive health registry, it should first have name-based data collection. That means like should record the name. It should have a privacy issue so that like no one can see it. It should have encryption. It should have username and password. It should be able to track individual all the time. So these are the different things what a software should have. It should be able to link with the mHealth. Is it a mandatory? Is it essential? Based on your country needs, you can try to decide. So these are the different functional area what we try to do. Okay, and then is how best we can try to use these ML devices. You know, the small phone, and if you have a long list of patient names to be updated. In Kenya, everyone uses English, it's first fine. But like in India, like it's not everyone are used to English. They have they can't type. What they use is just a number. And typing SMS is just like in very, very, very different. Yeah. So my mom and dad, like my dad, like at least like he types some SMS. My mom like says, nah, just numbers. So like it's based on the things like it's they can't really use, and it's very, very small. They can't see. So what all the different things can be done in the mobile phone? For example, registering a person. Registering a person requires entering the whole name, address, identifier, all the different things which will be complicated to be done in a mobile phone. But updating the information, for example, okay, all the things are there. Okay, today I have given, received ANC checkup. Click, that's it. No dates or selection. So then mobile phones are useful. So to update the data or given update the service delivery. Yeah, so which is useful, which is not useful. Now what we are trying to deal with it here is to specify how an IT application should look like, or should have. Yeah, what all the different components it should have. Huh? Yeah, and I'll skip this one. We already looked at it. Mobile phones, like I guess like Long and other people have talked about it. The other thing which is very essential is about this. Okay, now you have to help me, someone, doctor, hemoglobin. Yeah, if hemoglobin is less than something, then you have to do something, right? Especially if you're screening for a pregnant mother. For example, here, hemoglobin is 10.5. I don't know what the other thing is. Then a software application should give an alert saying that to a health worker, you should do this. So then like the health worker who is providing the details, especially like having the case, she knows, okay, this person is high risk, so I have to need to do these are the different tests I need to test. Yeah, I give things. Is this fine? Is this right?
No, what we believe is, a fundamental question about, can a health worker who's not a qualified MBBS doctor who can actually see a software recommendation and give something to a patient. So that is a more fundamental question. Yeah. Then, but other than that, this advice is okay.
Yeah. Actually, this is not for medical doctor. These are the things for the outreach nurse when they are looking at it. And if they have more complication, they can always refer to the doctor or something. But at least like for our health workers, what are the different aspects they should know? And how can the system or an application can help them in supporting this? The training material, or by like when they're registering some data, we can try to get some clinical decision, or just not a decision, but like just prompting some of the things. And then also confirming, yes, I have done these things, and confirm about it. Okay? So these are the different things. So we have ethical legal issues, then all this cycle combined together makes a registry. Yeah? Right from the ethical legal issues, like is this fine to collect the data? Is it fine to collect the names? Is it fine to collect the photographs, things? So from there onwards to the what data we need to collect, what are the different interventions, what we can use, what kind of tools or systems we can use, and then how best the system should help in our training the health workers. So all these component links together, it forms Reproductive Health Registry. And this is the initiative just started a year back, just making sure like how things are. And I guess like in the Philippines, we might take one as the pilot case, and maybe in Vietnam, and also in other places. These are some of the countries which were identified last time to start some of this pilot. And where was that? Lebanon or something which we were, the whole, the Norwegian government which was sponsoring. I'm not quite sure. Yeah. So, yeah, and this is some of the other tools which they use. Barometer. Have anyone seen this before? I'll just show these are the different indicators. This is how the performance it happens, and then just gives some of the rate. This is what the Norwegian health system used to give the feedback to their health department. Huh? So producing some of these kind of charts, automated chart in an IT application, whether by using R. R is a statistical package, like SPSS stats, but it's free and open source, where you can configure all these different things and you can get it out. Some of the, like say, including reports and charts combined, so that like you can get the automatic feedback, and then you can fill in the text, and people can get through it. Okay? These are the steps. So you can use specific components of this HR work package and start with it, and try to see how best we can use, okay, we just want to use ethical and legal package, or we can just use the data set package or the training package, so you can just like use those things for our own country needs. Huh?